Greetings to one and all, the most prized citizens of our country. This is Dr. Geetha Appachhu. I am a psychologist since the past 27 years now, the chief head of Swa-Preran. Swapreran is a Bangalore-based initiative established for psychological counseling, training, and assessments. In the past 4 months now, especially during this period of the pandemic, I've been involved in providing counseling sessions for emotional coping and holistic lifestyle modifications with several groups. At the outset, I must acknowledge the amazing service each one of you have been consistently rendering in this unprecedented period of global uncertainty. I'm sure your family, a lot of friends, the social media bombarding so much of information must be disturbing, must be also showing concerns in the most difficult ways. Maybe when you're just about to leave for your work on that day, your family talks about, oh, there's so much of cases today. Do you think you also want to go? Do you think that there will be infections in the hospital? Such questions, I'm sure, concerned parents, relatives must be asking you, is it not? As a psychologist, I take this opportunity to help you connect with yourself and evaluate your resilience. So when I talk about connect with yourself and evaluate your resilience, then the first thing is, let's find out, has it lowered? Can we build it up? So resilience lowering basically is where we find that we have been spending too much time contemplating about, oh, now the situation is getting worse. So will there be an infection with so many patients walking in to the hospital? And so many such thoughts may be there. What should we do to build our own resilience in spite of the way this whole COVID-19 is turning out to be? We know that there is going to be an alarming increase. We know the concerns of our family, of people who are telling us to be more and more careful. But is it affecting us negatively? Then let's actually understand that how can we build our resilience? Now let's look at the general experiences globally, worldwide, what is happening these days. One, that we are experiencing irregular work hours, that is happening. There is also higher workload, isn't it? I think most of doctors, nurses, and all other technical staffs in the hospital, including it could be even an ambulance driver, is probably doing a lot more when it comes to, pitching in more hours of work for the people who are absent or who are reporting sick. So there's a lot of anxiety as you enter a new or unfamiliar clinic role. So this clinical role is most often very distinguished, very clear to us right from the time your training is complete and you are in a hospital setup. But today there is a lot of change and it is new and unfamiliar, isn't it? Now there is also increasing risk of emotional strain. With so much of you running here, running there, so much of changes that is happening. There is physical exhaustion as the number of COVID positive cases are rapidly increasing. Well, there's also exposure to critical illness, death of colleagues, which probably is disturbing you. Okay, moral the dilemmas in decision making with limited resources, especially at workplace. Today, the resources is not, the same, is not consistent each day. this most often can disturb us. So this is generally what is being experienced. So when such is the situation, how do we create a psychologically safe environment? Because we cannot make any changes in the physiological, in our infrastructure, we cannot make changes in this scenario, then can we create a psychologically safe environment? This will definitely help us to have a very comfortable stay at our workplace, a comfortable mindset, be it at workplace or be it at home among our own people. So one is that let us find out, are we able to make morally challenging decisions? Find out you were able to make it earlier. So morally challenging decisions is today, should we shun away, should we shy away from our responsibilities which you have done passionately earlier? Well, the answer that comes from within is no, isn't it? That the challenge to be morally right, ethically right is always there. And also you have to choose between difficult options. This is also something where you will be able to understand that this is also something that we have to do every day. Manage stress, anxiety, and low moods. You find that sometimes your mood can go low when you find a couple of colleagues who are also expressing low moods, isn't it? So there's also where you should identify the signs of burnout. So maybe too many hours that you have been putting in, this could also be the reason of a burnout. And probably where you are finding that the hustle and bustle within the hospital premises, and the way you are seeing a very different kind of an ambience where a lot of people are engulfed in fear, that time this is something that can happen. Now, the first most important thing when we are talking about building resilience is, let us start accepting our feelings. So accepting your feelings is an important first step to build resilience. Let's remember that when we are looking within, when we are able to analyze, find out if you are able to also accept what you are feeling. Don't ever just push it away, push it aside. Working with complete awareness is what is required to create this psychologically safe environment. Are we aware of the way we are working? Most often, because of expertise, experience, exposure on an everyday basis, a lot of us, we are able to sit down and analyze that, we are doing most of our works very mechanically, isn't it? So this complete awareness is where we are discussing this inner awareness. Yeah, the inner awareness exercise must just not become a practice which we do for a couple of minutes because we are having someone to train us, we are having a command based inner awareness exercise which probably lasts for an hour or two in a day. Well, I would tell each one of you very passionately working in this particular scenario that your inner awareness should become a habit. It should become a part of your routines and tasks, right? And you cannot always control circumstances, you will agree, but you can always control and guide your own thoughts. That's the reason why your inner awareness is, when it is guided, you will find your thoughts are much more clear, are much more confident, and this is something that will help you to create a psychologically safe environment. When you feel safe, definitely you will find that your passion to work, your passion to be committed and dedicated is healthy and positive, is something that can go on, right? Now, what is within our control? There are some things which is not in our control, especially the way this COVID-19 is spreading, especially the way globally we are finding that a whole lot of things are changing around us. The kind of news that we are hearing from across the world. When such is the situation which is not in our control, then what is in our control? Well, focusing on what is important for me is something which is in our control. Let us start that focus. Yeah, what is important for me? What is important for this you? This is so important. One is that an important routine. Please do not neglect your routine. Please understand that your routine must be very clearly indicative of how you can have levels of satisfaction getting better each day. Although the situation and circumstance is not so good, is not getting better each day, which we all agree. Your diet, your exercise, your relaxation, apart from your commitment to work, apart from your passion to work, this is something which I definitely want you to focus upon because this is within our control. Well, now with the anxiety, low mood, and if this is the workplace scenario, then how do we basically work with this kind of a situation? Anxiety, feeling of helplessness, intense fear, prolonged low moods, these are experienced when there is lack of knowledge about emergency response. You'll agree that when you become technically very skilled, then most of our tasks at our workplace becomes very habitual, very mechanical. But then this knowledge is about your emergency response. Today, each moment you may find that it is like an emergency situation. It is not a mechanical one. Now here, you should not react. You'll agree with me that this response must be a very beautiful response, and that is what is required. Yeah, and also if there is lack of psychological preparedness, that also could lead to low mood and it could lead to a lot of anxiety in the workplace. So psychological preparedness is very important, dear friends. Please remember that if you're psychologically prepared, then you can face the situation which could be gloomy and make it a positive one. Also, poor sleep quality, please remember that this every day, any day will influence. Well, it is not just because of the pandemic. It is something which you have to understand. When we are talking about sleep, it is not hours of sleep. We are discussing here your quality of sleep. So that is very important for us to relate to. Also, perceived stress. When we are talking about stress, remember that how you perceive the stress is based upon what kind of an analysis you have made. What kind of analysis your mind is taking you through when we are talking about the stress. And so, stress because of the symptoms that you are seeing in various patients, stress because of the kind of situation and a rush in the hospitals, all of this can be perceived with more strength, can be perceived with, better preparedness psychologically. Okay. And depression, if at all you find that, your mind is somewhere moving to a all-time low, irrespective of the kind of care you are taking on yourself, the care that you are giving to yourself, please find out if there are symptoms of clinical depression. Then you may find that you're not prepared to handle your work with passion, handle your work with that commitment. This should not happen. Please do not neglect these symptoms. It's very important that you address it. Similarly, if you find that clinical anxiety is something that you are experiencing for some time now, then please do not neglect it. This is important. It is very important, be it a symptom or doubts, then this is something that will bring about the lack of knowledge or preparedness, and that I think we need to address immediately in order to bring about resilience, in order to start the build of resilience. Now let's talk about what is it that will bring about this change. Definitely you will agree when I say it's my attitudes, my actions. It's completely normal to be experiencing a wide range of emotions in this present scenario, but your attitude is the window to the world. You'll agree that the window through which you see the world. Your attitude is the mental filter through which you experience the world, isn't it? So this mental filter can be the filter of optimism. You'll agree with that. So please start with a clean mental window. Clean up this mental window. You will find that your attitude will bring about a lot of change in your actions, in your commitment towards your work. Actions here, what we are talking about is the way we conduct ourselves without putting ourselves into too much of stress, without actually being bogged down by the pressure in our workplace. This is what I was trying to talk about. This mental window, how can we actually start cleaning up, is basically by having the right attitude. So you will agree that we cannot control circumstances, but we can control our thoughts, right? I'm repeating this so that we remember that it's all about within us, because what is around us, our circumstances, is something which we are not able to make any change. So to change our experience of the circumstances, right now, this circumstance that we are talking about, the pandemic, in order to change our experience, first let us start thinking differently. Can we try? Okay. Psychological preparedness involves confronting the anxiety. So this is so important that please let us not avoid it. Okay. And confronting the anxiety producing event is so important instead of avoiding it. So this is what is important when we are talking about how do we bring about the psychological preparedness. We bring about only when we are able to understand that let us face this anxiety producing event. Importantly, appropriate emergency responses includes doing your clinical responsibility with awareness. So when we are talking about that emergency response, and we were talking about the lack of having the knowledge of how to deal with an emergency situation and how do we respond to it without reacting, it's very important that we start becoming very aware and we start looking into, are we doing our clinical responsibilities with awareness, complete awareness. Being focused and mindful will reduce fears. Trust me, it will reduce fears, control your responses to those hypothetical worries. You will agree that when we are not experiencing a particular situation or a discomfort, then till we actually are experiencing this, before that, what is it that we are having? We are having a lot of hypothetical worries. What if this happens? What if I get sick? What if I spread the sickness to my family? Right? Most often this is something that would be in our mind. But when it is a hypothetical worry, then such worries or other dilemmas can actually be reduced when we start becoming more mindful, because this will reduce the fears and it will control our reactions. It will control the way we are responding, the way we are basically continuing to work, right? So the technical know-how in us helps us to enjoy what we are doing. But without the psychological preparedness, there is so much of fear and those hypothetical worries which may mar the satisfaction in your everyday work. So that we go to work, we carry ourselves to work, then you have to basically remember that if you control and experience a beautiful shift in your thinking pattern. So controlling thoughts is basically shifting it to become more positive, to understand that we have to do our responsibilities with awareness, then these fears will go away, because the awareness is going to make us more clear and sure that we are not doing anything wrong to get an infection. So this is probably the best that we can think in this given period in time. Mindfulness is not just a short therapy. So there are so many mindfulness therapies and exercises. You can find a whole lot of it even today by various instructors and teachers on the YouTube. But then this mindfulness is just not therapy. Believe me, the techniques of mindfulness can become important professional personal habits. Now, please remember what you pick up during a training of mindfulness can be used to actually cultivate it like a habit on an everyday basis. Every moment can be guided with this mindfulness techniques that you pick up. So let it become a way of life. Let it become a way of helping you at any given point in time. Develop confidence and experience your negative apprehensions leaving you. Confidence is one beautiful requirement that will help you to take off the negative apprehensions. And this will help you to get involved more mindfully. Gear yourself with protect me, prepare me, support me, and care for me. This attitude will lead to the right actions. Try this, gear yourself with this. And actions of caring without apprehensions and being responsible without anxiety is something which you have to become mindful about. Actions of caring without apprehensions. Caring is what you do in course of your work, but without apprehensions, and becoming responsible without anxiety will keep you safe, will keep you prepared, that you are not constantly having this cloud of fear around you that what if I develop an infection. So this is the best that you can do, and with this you will find that you are developing a beautiful positive attitude which is so required, just like how medicines, therapy is required from outside. This is the inner requirement, and your inside doctor, your inner doctor is the best who can definitely start the process of healing. Thank you so much for participating. You have always been amazing in the sense of bringing about a difference in every patient's life in your own way, and let this passion which you have guide you to not just become responsible, but become responsible mindfully. This is going to help you to stay safe and also protect and help all those who require your service. This is amazing that what you have been doing is something which we cannot measure in terms of, okay, so many people got better while so many people succumbed to their illness. Well, not at all. It is that moment that you connect with your patients is what you probably cherish as a takeaway from the day. Wishing you all the best in life during this very difficult situation that we are all going through, and you are constantly working in a space which probably is gloomy, but then it's not just the lights that can brighten up your feeling. It is also your inner self. It's also your attitude. I'm sure just a peep into starting this new program of developing the right attitude will take you a very comfortable way each day at your workplace. Thank you so much.